This awful story out of Western Australia about a little 7-year-old girl who should have been treated by a children's hospital, instead was turned away by a children's hospital, and she ended up dying. It's an unforgivable tragedy, and the final report has now come out about what took place in Western Australia, and the opposition leader's joining us now, Mia Davies from Perth, to talk about this and about the pretty long line of failures when it comes to the health system in Western Australia. And the truth was, going into that last election, in the 5 months before that last election, ramping was getting worse and worse and worse. And in fact, this situation was very publicly available for anyone who wanted to see it in the lead up to the last election. And the truth is that the health system is bigger than COVID, and the health system in Western Australia is failing everything but COVID at the moment.
It's been an appalling day for the government when that report came down, Paul. They've failed this family. It is an example of just how much of a crisis we are facing here in Western Australia with our health system at a time when we need it to be operating at full capacity. It's devastating for the family of Aishwarya, but more, and I think also reflecting on the people that have had to deal with that in the hospital system. They're also devastated. They've been hung out to dry by this government because they haven't had resourcing.
Well, and again, the Labor Party, doesn't matter, state, federal, opposition or government, will do more for health. We'll do more for health. They had been in government for multiple years. They were in a position to do something, yet health was getting worse. Yet, unbelievably today, they trot out a public servant. Now, remember, the public servants, while they technically work for the minister, they don't work for the political party and the government. But I want to show you an example of someone spinning on the behalf of government, all right? This is the WA Health Director General, now not talking as the dispassionate member of the public service, sounding more so like an apparatchik on the behalf of the government. Remember, we're talking about a system that turned away a 7-year-old girl who went on to die. Roll it.
It's under significant pressure, like every health system in Australia. There is more pressure on the system, not only in elective surgery, but in emergency department, in mental health. You can see the government have announced 530 beds over the next year.
So there's all of these problems, but the government's solving it.
It's that's exactly the talking points that the minister and the premier have been rolling out, and the reality is that there's been red flags for the WA health system for 5 years. Under this watch, we've seen the health system stretched to capacity. They're letting the staff down. They're letting the people of Western Australia down. We've had a 300% increase in the hours that ambulance are ramped outside our tertiary hospitals in Perth. Increases in regional WA. We have code yellows. We've been at code black in one of the hospitals overnight. This is putting staff and patients at unnecessary risk, and we have such low morale within our health workforce at the moment because of the under-resourcing and because they are being asked to do so much with so little. It's unconscionable, and our call was that it's time for this health minister to go. They need to refresh and get a fresh set of eyes onto a system that is now at breaking point. And as I said, we need it operating at full capacity. We are very likely to see COVID coming into our community in the next few months.
Well, and also, I think we've got tape of the Premier today, sort of playing the "I'm keeping you safe" card, but he didn't keep this little girl safe. He didn't keep this little girl safe. A 7-year-old girl died as a result of the health system, and he has the balls to say this. Have a look.
It's about following the health advice and keeping Western Australia safe.
It's been a couple of really interesting days, Paul, because when the report came down, it made it clear that it was as a result of suboptimal staffing at the Perth Children's Hospital, that staffing was an issue. And they chose to pick and choose the words out of that report so that they couldn't have blame or didn't want blame attached to them for under-resourcing. So whilst there was the full complement of staff that had been allocated in the ED that night, what the report showed was that it was a suboptimal model that was operating in that hospital. And that comes back to resourcing, and that comes back to the minister taking his eye off the ball and holding those executives to account in the health system. And as a result, there was a report, 25 weeks it took for this family to have a report handed down, and they still don't think they've got the right answers. They still don't feel like the Premier and the government have listened and provided them with answers as to why their little girl is no longer with them.
Yeah, I mean, you know, for obvious reasons, if you know our story, you know, I obviously care about the little kids that aren't here anymore. But the thing, Mia, like, there are things that are supposed to be above politics that are supposed to trigger automatic accountability. But when we have sort of lost our soul to the machine of politics, that, you know, no rules apply and we kind of just barrel on, and unless we're sort of, you know, literally, you know, caught with a bag full of money or, you know, the videotape showing something more nefarious, then there's sort of a way to bounce through, and that speaks to, you know, a decay in the morality of how some of our people are running our joints. But all the best standing up to them. Nice to talk to you, Mia.
Thank you.